afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice in beautiful Encino, California. And I'm here along with my best friend, business partner, and colleague of many, many years, Dr. Robert Jaffe, who's also going to introduce himself.
Thank you. Thank you. I'm Dr. Robert Jaffe. Happy to be here with you guys today. I also am a licensed marriage and family therapist, certified hypnotherapist. I've been in private practice for a long time, and we're here to share with you some of what we've learned over many years of study and practice, the goal of which is to help you be a better version of yourself.
Exactly.
And the end goal is to be as loving and caring toward yourself as well as toward others as you possibly can be, because that's the only thing that's really going to make this world better, is how loving we can be with ourselves and with others. And so we're going to be talking a lot about sexuality in this first hour, and next hour we'll talk about stress and codependency and addictions. And hopefully this will be both entertaining and informative.
Exactly. And of course, we like to hear from you. And what would you like to hear in this program so that we can better, serve what you need and be able to answer your questions. So the first hour is about human sexuality. And last week we started to talk about factors that kind of it's a killer for sex drive, and today we're going to continue with the rest of that. I'd like to invite you to please give us a call online here. Our phone number live is 951-922-3532, and we appreciate the fact that you're spending this hour and the next hour with us. And also, if you can know of somebody that you believe that they can benefit from these programs, please let them know about us. Also, if you don't feel to come online and share about your questions, we understand that. You may contact us privately as well. We do welcome both of them.
Mm-hmm. Absolutely.
Right. So today, before the program, I'd like to share something with all of you, because we believe in sharing, and and sometimes we share things that they are so meaningful to us and has nothing to do with human sexuality or with trauma, but it's a reflection of what a beautiful friendship can look like, what an exchange of love can look like, and how we continue to reestablish, deepen our relationships in a so meaningful way, and how much we show each other how much our relationship means to us, and how much gratitude we have, and how it's important for us to recognize how we are loved and how we are loved. So today is my 63rd birthday.
It is.
I can't believe I'm saying that online. But then again, I feel safe to do that. And so I came to the office, and I had a very, very, actually two beautiful surprises waiting for me on my desk. So one of them was these beautiful spring flower arrangements, which I'm looking at them on the other side. And I wish I could bring them here to show them to you, but they're just absolutely stunning. And then I received myself this beautiful, birthday card. Okay. And so that didn't end here, actually. It continued with my favorite chocolate cake, birthday cake, right? And so I decided, what, I'm gonna make a wish online, and I'm gonna, do this online with my beautiful friends online, along with the person who did all of this for me, Dr. Robert Jaffe. Right? So thank you.
My pleasure.
Thank you so much. You have always shown me your love, your care in so many amazing ways, and I'm blessed to have you in my life.
Well, it goes both ways, and you are an incredible human being wonderful,
Thank you.
wonderful friend and great business partner. And I am also blessed to have you in my life. So
Thank you.
I like to show my appreciation.
Thank you. Well, you're doing so much is unbelievable, and I just want you to know that how grateful I am, to have you in my life. I really love you. Thank you.
I love you too.
Thank you for, I guess, it meant to be for us to meet many years ago, and we continued our journey this way together.
We have.
So thank you, God.
Yeah.
Make a wish.
Make a wish.
Right now. My wish is health for all of everybody across the globe. My wish is, having the sense of love for all of you and for us as well.
All we need is love.
All we need is love. Okay. Thank you. And I wish, I have to say, I already had a few bites of my cake. I couldn't wait. And I have to say, it's very, very delicious. I wish you could taste it as well.
Chocolate fudge.
So there you go. That's there is a description right there that's, avoidable. You can already even taste it, how much, chocolate fudge, tastes wonderful. And that's by far, my most favorite cake, and it has a beautiful message on it. It says happy birthday, Mitra, and with beautiful white chocolate, decoration and flowers, and just a stunning cake, and stunning in taste as well. Thank you.
My pleasure.
Okay.
My pleasure. So happy.
Thank you. I'm glad that, I shared that with all of you. And then with that, the topic of, all we need is love. And as part of love, we're looking always at, human sexuality. And we know that when people love each other, sex is, unavoidable. I'm talking about romantic love. And but there are things that no matter how much two people love each other and they want to be intimate with each other, there are things that impacts their sex drive. And people sometimes are wonder, what's going on? We love each other, we have no problem between each other, but then again, sex is not happening, right? So we see that there are other factors that can be, in our way of having those intimate moments with each other. Last week, we talked about some of them, which was stress, and how stress, takes the desire for sex away from individuals. And now these stress factors can be from work, can come from variety of sources, and may have nothing to do with each other as partners. But then again, when one of the partners or both feel anxious about certain things in life, and they go unnoticed, those stress factor kills the drive.
Correct.
Right? So we want to be mindful of that. The other one is if there actually are problems between partners, so that, when partners have the problems, they usually either one talks, the other one doesn't talk, or they both talk, but they just target each other. So like you say it, it is as though they're just listening to each other to respond to each other and defend themselves, rather than listening to each other so they can understand each other's point of view.
Exactly.
Right.
So that's one of the big questions that I ask couples as they're talking with each other.
Right.
Are you listening to respond, or are you listening to understand?
Exactly. And then one thing that I hear when they say, "What's to understand? She's so wrong, or he's so wrong." And I say, then again, are you listening to understand, or are you listening to respond? Because that's the respond, that's not listen, that's not understanding.
Right.
Right. So when people, they don't feel, sexual towards each other, is because they have been fighting, they're tired of fighting, and that's definitely an example of poor communication. Definitely, having an affair, it's a situation, or financial situation, it's a situation between the couple. So whatever the problem is, it's better to be talked about, it's better to be understood, it's better to be discussed. And if they can't do it, if you can't do it among yourself, it's best to, go to a professional who are specializing in couples therapy. And you really want to go to somebody who is not only a licensed, but also an experienced one, because just being a license, it doesn't mean that they have enough experience to do the job. And, of course, you're always encouraged to interview a few before you sit down with one.
Exactly. And it's difficult for a lot of people to know who is a good therapist and who isn't, because people come into a session feeling very uncertain of themselves and uncertain as to whether they can trust their feelings about somebody.
Right.
So that's why it is good to check in with yourself to see how you feel about the particular person, and then to share that maybe with somebody in your environment that you trust, and so you can hear yourself talking about it. And then if you're not certain that you really think this person can help you, then to try a few other people, one or two other people.
Yes, right.
And a therapist that is worth their while will encourage you to do that, rather than discourage you.
Right. So, and it is, one of the main reasons that helps the therapy to make positive progress moving forward is the connection between client and therapist.
Mm-hmm.
Right. Without that connection, without that therapeutic connection, therapy is not going to be effective. So you want to make sure that you connect to somebody that you can really find comfortable to talk to, and you feel that you are heard by that person.
Yes.
Right.
Mm-hmm.
So that's very important. And then the next one that we talked about was the consumption of alcohol. And then we know that definitely that's a deal breaker. Now people think that, oh, we have a couple of wine when we have dates and, and all of that. But the reality is, alcohol is alcohol.
Mm-hmm.
Right. And usually we know that, when I talk to couples, they say, oh, we didn't drink much. We just had 1 or 2 bottles of wine. So that's plenty.
That's a lot.
That's plenty. And that definitely is a deal breaker. It takes away the desire for sex. Usually people pass out. Usually people, even if they have sex, they don't remember most of it. So that's not really a healthy choice of becoming intimate or staying intimate if you're looking for, a meaningful, sex. So that's not gonna help. The other one we talked about was, not getting enough sleep, and that, of course, it impacts not only, sex drive, it impacts variety of areas of life,
mm-hmm.
right? We know today that lack of sleep or not having quality sleep, it actually, contributes to many of our diseases, such as diabetic type 2, such as hypertension, right? Such as chronic fatigue. So many situations are out there that, and then lack of focus, of course, and productivity. So sleep can, impact definitely our sexuality and sex drive. So we just got the notice that we are going to our commercial break, and we're happy to get back to this topic after that. So see you within a few minutes.
Check us out online at KMET1490am.com.
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-2-Heart at KMET 1490 AM ABC News Radio. For those of you who just joining us, we're talking about aspects that impacts sex drive and lower sex drive, which is an important part of romantic relationships. And We would like to hear from you, from your experience. So please call us at 951-922-3532. You may also visit us online at YouTube, heart-2-heart.online/YouTube. And yes, please call us and introduce this program to those that you believe they can benefit from. So while we were having our commercial break, my birthday party continues, right? So we just had, a few bites of this amazing creme brulee with one strawberry at the center of it. So it's an individualized one. And it tasted so creamy, so velvety, so beautiful. And I'm afraid to even look at it because I might finish it, and I'm 63 officially, so I have to watch out for what I'm eating, right?
Yeah, we actually all do, but
Yeah.
we become more aware of it as we get older.
Exactly. So I'm officially there, right? And I really feel good about it. I think I'm at the age where I can do just about anything, and I don't have permission from it.
That's right. Don't need permission.
Isn't that funny that we think that we need permission, at any time to begin with, right? We need to experience life, as our own free human being that we are. Of course, I'm not talking about childhood or things like that. But
Yeah, well, a lot of what we're talking about and what we've written about is our authentic true selves and how that gets lost often through childhood experiences where we have parents who are less than understanding and less than empathetic with us.
right.
And so our authentic true selves get lost and often stay lost forever until and unless we start to recognize that there are symptoms that are happening and someone is willing to help us with it.
Exactly. So, again, I'm happy I'm at the 63. So going back to our topic, what impacts sex drive, and as much as we love them, as much as we adore them, as much as once we have them, they take over everything else that we love in life, is having kids. Right. So I hear from parents significantly, in particular since the pandemic started, right? They don't have a minute to us to have sex anymore. And that
or even to take a shower.
Or even to take a shower, right? And in particular, women complain about that because not only now they have to take care of their career, and not only now they have to take care of kids, they also have to cook more than 3 times a day. And therefore clean up more than that, right? And yes, their partners, of course, help. Some of the kids that they are grown up, they help, but still, the pressure is significantly more on a female in the house than it is on the man of the house.
True.
Or at least, this is what I hear, right? And then when you have kids at home, unless they are really young kids who they don't understand about, sexual activities, if you have an older children at home and not they are home 24/7 because of COVID, I can understand that. Where is the time to have sex or privately have sex? And then, or how many times can a person have quiet sex? Because there are times when people have actually quiet sex. They don't make a sound. They try to make the movements really minimal. They even have sex on the floor instead of having it on bed, so that the bed doesn't make any sound. So they feel embarrassed about what's happening during sex, the sounds, the movement, the sound, all of that. So parents, and then of course they're tired at the end of the day, so they just say, what, forget about it. So what if that's your situation, and then sometimes also the kids, they just abruptly open the door, and if the door is locked, they start knocking at the door, right? So we understand the interruptions, we understand the limitations. However, there are ways around that, right? So you can always, ask somebody who you can trust to watch over the kids and take a weekend off.
Yeah,
Yeah.
and that is very, very, it's a very important point that we need to still have our adult time
Yes,
and our couple time.
exactly.
And of course, when the kids are just born, that isn't possible really. But as the kids get a little bit older, 2, 3, 4 years old, it's important that you do that. Number one, it's good for the kids to learn that they can be with other people and allow other people to take care of them. Of course, you got to have people that you trust.
Right.
And you start off with maybe a couple of hours, and then you build up to one evening, and then one evening and one day, and then maybe 2 evenings. And the kids, it's a little break for them too, and it's a break for you, and it's very important because oftentimes we devalue ourselves and we overvalue our kids, and that isn't good.
No, that is not good. And then the point is that that's a very important point, by the way, that when we do that, the kids are going to get used to that type of, approach,
Hmm.
not just from the parents, but from everybody else,
Right.
right? So we're setting them up for, for what do you call it? For
Disappointment.
disappointment. Thank you.
Hmm.
And unhealthy relationships,
Mhm.
right? Having unhealthy relationships. Uh, when kids used to go to school, when partners used to go to work, and many times, most of the time, partners have two different jobs, so they don't go together to the same job, right? That was actually, both mental and physical break that we gave to each other every day,
Hmm.
right?
Right.
So coming back home was kind of, reuniting with each other. It was, we always said, oh, I'm tired, I want to go home, with my kids, with my wife, with my husband, right? So it was exciting to go home to those people,
Hmm.
right?
Hmm.
However, we needed that mental break and physical break.
Right.
But right now, we don't have the mental break, we don't have the physical break. We kind of, I hate to say it, but we're sick of each other. Right.
Well,
which is not, I'm saying that in a loving way, right? And I love you, but I need a break from you, kind of a thing.
well, yeah. I mean, because being our authentic, true selves means that we honor our own needs and desires.
Right.
And I think it's important for people to understand that we're here to take care of ourselves. And then if we do a good job of that, then we have enough to give to other people.
Right.
But if we're not taking good care of ourselves, then we're very needy, and we put pressure on other people to do for us what we can be doing for ourselves.
Exactly. Yes. So let us know. We would like to hear from you. And what do you have experience having your kids around yourself? Especially during pandemic, and how you have managed to overcome the challenges that you have faced when it comes to your sexual relationships, and what you have done for you that for yourself that has worked, so that we can share that with everybody else, and then we can help other people who are suffering from this. And we always need to take care of ourselves, and then our sexuality, sexual needs are at the top of everything else. I mean, we put everything first, and then we need to learn also to put our sexual needs first as well, right? So the next one that really impacts, a sex drive is medication, right? We talked about antidepressant, blood pressure medication, birth control pills, right? And then, of course, birth control pills, some studies show a link to low sex drive. Some studies don't, and there are some studies that they are still kind of in between, right?
Yeah, and I think you're bringing up an interesting point, because we are all similar, but we are all not the same.
Right.
And our physiology, although the organs are all in the same place, we don't respond to medication or anything in exactly the same way.
Exactly.
And some people, like for example, the COVID vaccine, right? Some people are having a real hard time with the second shot. Some people it doesn't bother. And what's the difference? It just happens to be the way the physiology of the person is.
Right.
And so some medications may affect your sex drive, and you know, you're having a hard time with it, and somebody down the road isn't.
Yes, but generally these are the categories that
Oh
we
yeah.
hear, and also like anti-HIV, drugs.
Mhm.
So uh, this happens. So while we know that that medications may have side effects that can actually impact our sex drive, I think we shared about this a little bit the last time. But we see that even physicians who prescribe these medications, they don't say that, guess what, patient? One of the side effects you may experience is having low sex drive.
Right.
Or even no sex drive.
Right. Or for a man, like retarded ejaculation, right. And for a woman, difficulty reaching orgasm.
Or reaching orgasm. So here we have, a high function sexual couple that one of them or both start taking, some medications in that category or other categories that we haven't mentioned here. And then they suddenly face each other and no sex drive.
Mm-hmm.
And then the first thing they usually do, as we hear it in therapy, they start blaming each other.
Mm-hmm.
I think my husband is having an affair after his surgery. He no longer shows interest in me.
Mm-hmm.
Oh, I think my wife, something going on with my wife. She's no longer interested in me,
mm-hmm.
right?
Mm-hmm.
And then, so instead of communicating with each other, they go at each other,
Right.
Right?
Attacking
each other, or starting complaining about each other, or becoming sarcastic with each other,
mm-hmm.
right? And usually, if that's not, understood, and if that's not processed, the arguments and the challenging communication increases,
mm-hmm.
right? And then it gets to a point that they don't know why they're fighting, but they're not happy. Mm-hmm. And that unhappiness that has already started initially, right, it actually escalates to the point where the couple are really becoming, separated from each other.
Right.
And by the time all they had to do, all that was needed to initially to be introduced to them is that if you're taking this medication, be mindful of your sexuality.
Mm-hmm.
And since that simply was not communicated or is not communicated, people won't know. Many people, when they go to their pharmacy and they get a medication, there is a literature that comes with that. And I am taking some medications, and I have looked at those literatures, and I seldom see anything about sexuality.
Mm-hmm.
Right? And it is so generic and it is so general that it applies almost to everybody.
Yeah, and the warnings are often so many.
Yes.
And so you wonder why you're taking the medication to begin with.
Right. So as a result, I see some people when I'm in the pharmacy line, I have seen people who get their medication, they just they get the bottle, and then there is a trash can, they just dump the information along with the packet in the trash can. They don't even bother to read it.
Mm-hmm. Right.
So even if the matter of sex drive is indicated in that list, right, they don't get to see it.
Right.
And then, so I myself, I find that the physician's responsibility
mm-hmm.
to verbally inform the patient about possible side effects about, of taking the medication, and one of the side effects be low sex drive or no sex drive.
Right.
Right. So that the situation doesn't become, chaotic, out of control, out of hand, to get to the point of, argument and separation between couples, because couples don't know. They think they're taking the medication, like you said, for a good cause,
mm-hmm.
but they don't know that good cause can actually take away something more pleasurable out from them, from their relationship.
Right.
Right.
Exactly.
Yeah.
Yeah. Yeah, because like even with the vaccinations, right? They say you can have symptoms, you might have a fever, and if they didn't tell you that, then you really get scared.
Yeah,
Mm-hmm.
exactly. So it's better, and even if you're so don't be shy. And here's where I want for you to be proactive about your health and about your sexuality. So I do invite you, the next time your physician is giving you a medication, or if you believe that you're not having sex as often as you wish to have compared to before taking any medication, go back to the prescribing physician and ask them, by any chance, doctor, is this medication is causing me to have low sex drive?
Mm-hmm.
And I bet you more than 50% is yes.
Mm-hmm. Mm-hmm. Right.
And then you're wondering, oh my God, so I had all these negative thoughts about myself or about my partner all this time, and all I had to do is check on this little pill I'm taking.
Right.
Right?
Mm-hmm.
So, and I have seen some physicians, they actually prescribe Viagra for those men who are coming and they say, I have low sex drive, and without checking what other medications they are taking.
Mm-hmm.
So,
well, you can also get Viagra online now without any prescription.
Oh, really?
Yeah.
Oh, okay. Well, that's
Yeah.
right. So, well, that isn't that dangerous to do?
It is. It is. It's
It
dangerous.
is very dangerous.
Yeah. But you can get it. You can get it. I don't know if you can buy it here in the U.S., but you can certainly purchase it online from Canada or from some other countries that sell it.
Well, I myself, I wouldn't recommend that because, because of the many side effects.
Mm-hmm.
So we will continue with this right after our commercial break next, and we talk about more of this situation. Please join us.
See you soon.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio Live. Today we have a special Mitra's birthday, 63rd birthday, program as part of our human sexuality, right?
Mm-hmm.
So in between commercials, we are celebrating with cake and with creme brulee and strawberry and coffee. So wow, okay, what a beautiful program. So we have been talking about factors that impact sex drive. The next one is poor body image, and boy, if I can, I want to talk about that. It's going to take me maybe a few weeks to just talk about, body image and how that's a killer to sex drive and how women feel about themselves. And these days we see that how men also feels about themselves and their body. So it's just not that much just focused on women. Yes, the focus is more heavily on women body image, but then again, men also, they have joined this category as well. And also how both partners, they have expectations from each other that how the body should look like. And some of the expectation is out of this world. What we see on commercials are out of this world. So many things that we see, I mean, they look good, they sound good, they feel good. However, they are not real. So when it comes to body image, we have to look at ourselves, what exactly our body image means to us before we go on and, try to be something that we really are not, using plastic, using medication, using diets, using yo-yo diets, and many factors. I mean, it's really important for everybody to understand their body. And of course, health comes first. Exercise and eating right is always encouraged. But to look like so and so that you see in the magazine is not going to get you a healthy relationship. Right.
Right.
So that's the factor. And then next to that is obesity, right? We have seen that people who are overweight and or are obese, because these two categories are different from each other. Somebody can be overweight 10 pounds, 20 pounds, 30 pounds, or 40 pounds even, but if it is more than that, and depending on the BMI level, people can be, they can be considered as obese, right?
Yeah.
So the more obese a person is, the less sex drive they may have, and the less they feel good about themselves to have sex and therefore to enjoy sex.
Yeah, and of course, what we're talking about now are generalizations,
right?
And there are many exceptions to the rule. but you're talking about things that can happen.
Can happen.
Yeah.
Yes.
Mm-hmm.
Right. And one of the reasons that maybe perhaps, and I have heard from obese people that they don't feel good about having sex, and therefore they just so internalize that about themselves that they don't even at some point feel sexual, right?
Mm-hmm.
And they said, well, I'm fat, and who wants a fat person, or so many other negative comments that they assign to themselves.
Mm-hmm.
Well, the reality is our body is not a representation of who we are. And as much as people don't want to believe that, some people don't want to believe that, but it's the truth. And yes, physical attraction is important. And then sometimes, people who are overweight doesn't mean that they're not attractive. But then again, overall, obesity from physical perspective, from organic perspective, can lower sex drive naturally. And then some people are taking diet medication in order to lower their appetite. Some of those medication can impact sex drive as well. Mm-hmm. So if that's your experience, then you may want to consult your physicians to see what other ways they are that they can help you with weight loss, or if you are on a weight loss program, and then to how you can enhance your sex drive. The next one that's really important for men, of course, is erectile problem, right? Men, some of them, may experience, erectile dysfunction at some point in their lifetime, which is, and then some of them may actually experience erectile dysfunction at the onset of when they start having sex, right? So either one, needs to be consulted with physician, right, to see whether there is an organic cause, or whether it's a genetic cause, or whether it's situational. Many things can impact, a man, erectile functioning. All the factors that's from the beginning that up to now that I have mentioned, that I have gone over the list, can be a contributing factor to the experience of erectile dysfunction. What we know is, for the most part, erectile dysfunction can be treated, and couples, who have had this experience can go back to enjoying their sex life, and to their sex, sex drive can be, definitely, enhanced and improved once they know where the source of issue is.
Correct.
Right. In particular, if for those men who experience sexual dysfunction after years of having sex initially, right? So those are secondary erectile dysfunction, and those are situational.
Well,
right?
Maybe situational,
Maybe, yeah.
Or there can be something that has happened to their body that they're not aware of.
Right. So situational means, for example, an illness. Situational, maybe, for example, a change of job, or a loss of job, or a stress factor, sudden stress factor. Even a birth of a child can cause sometimes, erectile dysfunction, right? Because
Correct.
anything that shifts, the attention from one source to another source can be a cause of secondary erectile dysfunction, and usually with a little bit of a therapy and all of that, it can go away. And of course, if there is an organic cause, even as a secondary one, a physician is able to help with that.
Yeah. So I want to add that, one of the biggest problems in our society in general is what we would call in psychology denial. Denial means that you don't want to face the problem. So you try and ignore it, or you make excuses for it. And so what happens, let's say in a sexual situation, if the man feels insecure and he starts losing the ability to get or maintain an erection, he starts to make excuses for not wanting to have sex. He doesn't want to admit that he's having trouble, getting or maintaining an erection. He believes that it's unmanly. He's very critical of himself for it. And so nothing gets done. and then his partner then starts to feel that she's being ignored, and then starts to make up a story as to why she's being ignored, and things start to go downhill in the relationship. And so there's nothing worse than denial for keeping the problem the same or making it worse. So we have to be brave and admit to what's really going on, and whatever it is, we can't work on something that we're not admitting is there. So I just wanted to add that because it's very, very important. And you're talking today about a lot of possible issues that people can encounter, and we don't expect you as an audience to memorize all this and know all of this, but you will know your body and you will know symptoms. And when you have symptoms, it's time to ask for help.
Exactly. And I think that what you just added is such a crucial and important point to have, to be mindful and to have awareness about changes that happens in our body.
Mm-hmm. Right.
And not to dismiss it. And, people say, oh, I don't feel well. I'm going to call my doctor one of these days, to see him or to see her.
Right.
Well, one of these days, sometimes it was yesterday.
Yeah. And sometimes, it can be an actual life-threatening thing.
Right.
That we put off until it becomes very serious, or sometimes even until it's too late.
Exactly. So we don't want to do that. And again, related to men, the other factor that may lower sex drive, actually kills sex drive, is the level of hormone called testosterone, right? Which is is significant to a man's sex drive, right? Usually, testosterone level drops by age, right?
Yes.
And then, of course, it varies the degree of that. In some men, it drops sooner, and some men it drops much later, right? And I guess, that's when Viagra comes to the play.
Well, actually,
right.
We're talking about testosterone. One of my clients today felt as though he was sluggish, and it really didn't affect his sex drive, but he felt like he was sluggish, he wasn't sleeping well, and he went and got blood tested, and he was low in testosterone.
Right.
And so the doctor is going to be giving him minute quantities of testosterone. There's a number of ways that you could do it, through injection or through a patch, and so it's not that he didn't get an erection. It didn't manifest that way, but it was a testosterone related problem.
Right. Yeah. So in general, both male and female, a drop in our normal level of hormones can significantly impact our sex drive, as it impacts any other areas of our physics, right? For example, for women, when estrogen level drops, right, so women go into menopause, right? And so the impact of that varies between women and to women, and depending on for some women, depending on how they have taken care of themselves, but in terms of eating healthy, exercise, the impact of low estrogen may be less, at the beginning of the reduction part of it than to other ones. Some women have a much healthier bone density, some women don't, right? Right. So some women may not get, bone density problem until much later, and some women, they may get it immediately at the onset of their menopause, right? So it depends.
And some women hardly experience it all.
Right. Some women hardly ever experience, the symptom of menopause. And exactly. I'm one of them. And myself, you're smiling, so I'm going to say it. Yes. Yeah. And I was really surprised that I didn't experience anything. And I was waiting and waiting and waiting and waiting and that waiting. And finally, I talked to my doctor. And my doctor said, well, you are in the middle of menopause. I said, but how? And then she explained to me why I wasn't experiencing, the symptom of menopause, and I was very excited. I said, "Holy, that's so wonderful,
Yeah.
And but there are women I know of that, you know, at the age of 25 they went to menopause, and a bad one too. You know? So hormones, they don't have a timeline about how they're going to kick in or how they're going to reduce. We have an average, and that average, it doesn't apply to everybody. However, we want to know about, you know, if they have started to decline, and with that decline, how they're going to impact not only any other of our functioning, but how is it going to impact our sex drive, right? So that we can do something about it at the onset of it rather than much later time.
Right.
Right. And actually, we were talking about menopause. So yes, that's another one that's really, you know, impacts, you know, sex drive. So for women, symptoms of, you know, vaginal dryness and experiencing pain during sex. But then again, that doesn't may not apply to everybody, and but majority may experience that. And then of course, menopause. When women start going to menopause, they feel like they're done, and then you know, that impacts not only their self-esteem and self-worth, but ultimately it impacts their relationship. Right. So menopause is not the end of the world. As a matter of fact, you know, menopause is a wonderful time to focus on sexuality, because you don't have to worry about pregnancy, you don't have to worry about birth control, you don't have to worry about many things, right? You don't have to worry about menstrual period, you don't have to worry about any of those that puts a limit on women. About, you know, some women believe that that's a limitation, but they are not. But then again, it's something less to be, you know, mindful about.
Right.
Right.
And the flip side, of course, is oftentimes that causes menopause causes vaginal dryness, which can be problematic in and of itself.
Right.
Because even though we have lubricants, it's not the same.
It's not the same. So there are solutions to all of that. Unfortunately, we just ran out of time. We are told that we are at the end of our program. We are happy to answer any question that you may have about these situations. I'm here and Dr. Jaffe, and we are delighted to help you out with your questions, but we need you to call us. So our program is ending today, and I would like to invite you to join us at 4 o'clock so we can have a conversation with Dr. Robert Jaffe about addictions, relationships, trauma, and codependency. So until then, within a few minutes, don't forget that all you need is love.
All you need is love.
And thank you for sharing my birthday today. Thank you, Dr. Robert Jaffe, for my birthday. And you know, I know that the third part is coming up. I'm so excited to know what that is. Okay. All right. We'll see you in a short few minutes.